explain what's a doubt?
Can we explain the dispensing pharmacy?
Yeah, dispensing pharmacy or a hospital pharmacy or a small scale pharmacy, that is our main priority. So if you take a pharmacist role, your main priority is serving the human. Okay. So as a pharmacist student, the dispensing area, we have to have a real interest towards the mankind. So what is the first thing is, we have to have the real interest towards the mankind. So we have to love people. So when we are dispensing a small thing like a Digen, whether it is needed to give the drug, if you are giving a drug and there are some drugs, it will be looking like sound will be similar. So we have to ask for the prescription. Okay. So when you have a dispensing, when you are doing a dispensing job, this is highly responsible job. Okay. While a B.Pharm student is meant for two things. One is mainly meant for two things. One is industrial side and another one is hospital sector. So your doubt is regarding dispensing. So once we are having a model pharmacy here. We are labeling this as antihistamines. So this comes under the classification of H2 receptor antagonist recently introduced, montelukast and levocetirizine. See this drug levocetirizine, there is a drug like Sedget. It is cetirizine. Talking about the drugs, isn't it? So you are having an antihistamine like levocetirizine, as I told earlier. You have to explain to the patient regarding its bioavailability as well as you have to tell the adverse effects. Okay. Certain drugs we need to tell the way of taking the tablets. So if you take like H1 receptor antagonist, you are having a drug like pantoprazole. The pantoprazole you have to instruct them like the pantoprazole, like it has to be taken before the food. Half an hour after taking the tablet, you have to tell them you have to eat the food after half an hour. Then only the bioavailability will be enhanced. Okay. So you need to explain this, and in case you are having you have to be familiar with the brand names. Okay. So you are having the glimepiride and metformin. So this, while you are dispensing a drug, you should check whether it is 2 mg or 5 mg properly. So instead of 2 mg, if it is 1 mg and you are giving 2 mg, means patient life is under risk. So while you are handling what type of drugs, you are taking antidiabetic drugs, you are taking drugs which are acting in the hypertensive drug like beta blockers, you need to know the mechanism. For example, see there is a chart. You are having this chart which explains beautifully about the blood pressure. Okay. So if you are, this is a systolic and this is one is diastolic. And normally if you take an average, the systolic and the diastolic is 120/80. And it varies from patient to patient. Are you getting me? That is, if you are taking for example 1, 2, 3, the first person may have the range like 110/70, and you may have like 120/80, and she may have like 125. So you should know the upper limits. Okay. In our family or in the patient, if a patient is coming with a discussion or with the doubt regarding blood pressure, you have to explain that. Before confirming a patient as a hypertensive patient, the blood pressure has to be monitored 5 consecutive days. So what is the first tip? The blood pressure has to be monitored 5 consecutive days. So you are taking blood pressure in the morning 8 a.m., evening 8 p.m. So it is like you are checking this, you are noting this. So as a pharmacist, after this 5 days only, you can tell that patient is confirmed with the condition, that is high blood pressure. Are you getting it? So while you are having an instrumentation, we are having an instrumentation, isn't it? Sphygmomanometer, we are having a mercury level. The instrumental variation is also there. So nowadays we have digitalized. So we are tying the cuff and we are measuring the blood pressure. So when we are measuring the blood pressure may go 5 or 10, difference will be there. So this and all, as a pharmacist, we must be aware about the digitalization also. Okay, this is the first point. And coming to the second point, you need to advise with more products. Like if a person is, you are running a pharmacy, you are seeing a patient with this complaints. You should not give the medicine. That is the first thing. You should not give the medicine without any instruction. That is your responsibility in dispensing a drug is highly sensitive. So while dispensing, according to WHO, the dispensing time, if it is enhanced, you can decrease the disease. So your person is coming with the antibiotic schedule. For example, in the antibiotics, you are having more number of antibiotics, like you have studied, isn't it? Broad spectrum, narrow spectrum. So this is ciprofloxacin. You are having a ciprofloxacin. This is manufactured by country. So what is the difference in the price? And also, what is the patient history? You have to have a. If you are having the drugs which has to be monitored, for example, CNS drugs, CNS drugs, you are having a stroke patient, you are having a epileptic patient, you have to have a proper protocol. So that is, you have to know like how your schedule note should be. Your schedule note, serial number, name of the patient, name of the doctor, prescription, quantity, and then batch number. Batch number should be accurate. Okay. Nowadays it is computerized, so it is digitalized. So this batch number, once you are entering, stock also can be verified. So this batch number, manufacturing date, expiry date, everything has to be monitored. And finally your pharmacist sign. So once you are dispensing your drug schedule H drugs, it has to be signed properly. Okay. So now we have seen about the pharmacy, what all the things, and how to monitor the daily conditions like blood pressure, and how to handle the drugs like antibiotics, and also how to handle the drugs we are giving like antihistamines, and also what is our role is healthcare system. So we have to be very, very sensitive while dispensing the drugs. Once you increase the patient counseling, the patient inflow will be enhanced. So that should be in your mind. It is two things. We are doing a pharma business as well as service should be the priority. So what will be the priority in future? Service to the mankind is the priority. Okay, thank you.